Hello everyone. Today my topic is the simulation training on emergency care situation. And I'm Dr. Arkers Wong, and I'm from Hong Kong Polytechnic University. First, I want to introduce myself, and I'm a clinical associate in the School of Nursing of the Hong Kong Polytechnic University, and I'm also a fellow since this year. And I have been working in a lot of different disciplines like medical, surgical, and also oncology, and accident and emergency department for more than 10 years. And also I am an honorary nurse in A&E department in QEH. And because I need to teach the ACLS, so I also obtained an honor from American Heart Association and become their instructor. And my research area is in community health service, elderly care, and also health social partnership. And this is me, you can see, and I like to traveling around the world and to present, and that's why today I come to OU. And then, as I said, I'm a fellow in Academy of Nursing. And I like the relationship between me and also my students. And you can see I have a lot of sharing of photos to you, like this. And we also had some gathering before. And then I'm an honorary nurse, and this is the dorm of A&E department in one of the very famous hospital, one very famous teaching hospital. And this is my hobby. I like to sing, and I sing in one of a very spectacular event, that is the 40th anniversary of our School of Nursing. And this is my family. I have two lovely kids, and of course, my lovely wife. So I just want to let you know about some of the settings in Hong Kong Poly U. This is Hong Kong Poly U, and you know that maybe the setting is not like this right now, but later on I hope we can resume our duty and also resume our setting. And then this is School of Nursing, and I just want to introduce a little bit of settings inside. For example, we have 9 integrated teaching labs here, and also we have 2 traditional Chinese medicine labs. And we have geriatric care teaching lab and also the mental health teaching lab for different types of students. And this is the intensive care unit. And you can see a lot of students here are very happy to have the sim lab. And so today my topic is simulation lab. So simulation is also one form of advanced technology. Of course, you may know, because you may also come across simulation lab in different settings, in different universities. And simulation lab, of course, can provide a very good benefit or advantage that we don't need the student to go to the clinical placement to maybe to harm themselves or even harm the patients. So they can perform the skills safely in the clinical settings. And then, of course, if you have come across the some typical events like the cardiac or even resuscitation events, even you have the knowledge, you may be very scared of the situation. You may not perform very well. So in this case, we, as in School of Nursing in Hong Kong Polytechnic University, we try to handle these barriers or tackle these barriers by giving the simulation lab to the students starting from year 3. And you can see in year 3, in academic week 7 to week 11, we will have simulation lab in both semester 1 and semester 2 to the year 3 students. And each lab consists of 2 hours with 5 scenarios. And of course, these scenarios or this simulation lab must be aligned with the knowledge that taught in lecture. What does it mean? That means, of course, the students should have the knowledge before they can come to the lab. So these are the contents of the case scenario. That means before we can write the case scenario, we must give this scenario to the course faculty. And also this content or this case scenario should be reviewed by 2 A&E senior staff so that they can give us some advice for the contents, for the realistic content And then for the simulation educators, that means me, I have the significant previous experience, of course, in A&E. So I can also formulate the case scenario. And then this case scenario is based on, we call it ABCDE approach. So this is the content or the case scenario. What does it mean? That means here, for example, we have one patient, we call it Hello Kitty Mao or Hello Kitty Cat. Okay, she is a female and also 38 years old, and she is hurt in a car accident and fractured 3 ribs. And her condition is as follows. You can see from the vital side here, the BP a little bit high, the pulse a little bit high, RR as well, and the SpO2 a little bit low because as the normal range is from 95 to 100, and also she is complaining chest pain, and the pain score is very pain. That means 10 out of 10. As the students need to have the knowledge before they come to the simulation lab, so we must give some knowledge input to them first. And we must give 2 types of knowledge here. The first one is D, C3, A, B, C, D, E, F, G, H, I, J. And then the second one is when or how to call trauma call to the patient. So I just briefly elaborate what is D, C3, A, B, C, D, E, F, G, etc. Okay, so D is danger. That means whether the place is danger or whether this place will danger the patient as well as the healthcare professionals. And for C1, that means call for help. Of course, if you can see a patient with 3 fractured ribs, we must call for help. Call for doctor's help and also the nurse help. And then C2 is calm. You must remember what you should know and then apply to the patient. And C3 is cardiac arrest. That means you need to know how to look at the cardiac monitor so that you will know, oh, the patient is having cardiac arrest, and then subsequently you should know what to do. And A, of course, is airway. To open the airway by using, for example, this one we always call it ET tip, right? That means endotracheal tip. And then how to insert the tip to the patient. So they need to know about the technique and also how to assist the doctor to insert the ET tip. And for the drug, they need to know what kind of drug they need to give to the patient before inserting the ET tip. For the briefing, after inserting the ET tip, we must give the ambu bed to the patient. And for C, how to give maybe CPR or what kind of drugs or medication to the patient if they have some kind of rhythm, cardiac rhythm from the cardiac monitor. And they must know how to interpret the ECG so that they will know the rhythm, of course. And for D, that is disability. That means about the spine. They need to know what kind of problem the patient may have in terms of the spine. If the patient has some spine injury, of course, they may have some kind of symptoms. So they need to know what kind of spine is affected and what kind of symptoms because of the affection of these nerves. And the exposure is that we need to remove all the clothing from the patient so that we can know whether the patient has wound inside, for example. And family, we need to talk to the family, and also we need to set some expectations to the family. And for G, that means analgesia, if the patient is feeling very pain. So we need to give maybe analgesic like morphine. For the H, that means pregnancy test, especially if the patient is female, like Hello Kitty Mao. And for I, that means infection, whether the patient has infection, whether the patient has sepsis, so that we need to beware of this and also give the IV antibiotics to the patient. And then for J, that means gel. If the patient really need to have some investigation like ultrasound, then we need to give the gel to the doctors. So after talking about A, B, C, D, E, F, G, H, I, J, I need to talk to the student about what is trauma call. Trauma call, that means if the patient come to the A&E, and then because in minor case, we only have A&E doctors to look at the patient. But if in severe case, we must call the trauma call. That means we need to call different kinds of or different types of doctors to come to A&E to visit the patient and also to assess the patient. So you can see this is the trauma core guideline from the hospital authority. So what kind of things we need to pay attention to, and also what kind of guidelines we need to know so that we know how to call the trauma core is from this guideline. And then what kind of personnel we need to call. For example, relatively minor case, then we need to call, for example, here, you can see maybe the A&E, of course, we don't need to call, but we need to call the ICU, and also we need to call the trauma nurse coordinator. But if in severe case, we must call maybe neurosurgeon, pediatric, cardiothoracic, depends on what kind of problems the patient is suffering. So after the students got the knowledge, then what's next? So self-confidence actually has been cited as a barrier to performing high-quality resuscitative care. If the students do not have the self-confidence, they may not perform very well after they go to clinical placement. So we need to boost up their self-confidence by using the simulation lab. And before they come to simulation lab, we will tell them to fill in, to complete this questionnaire, so that we will know whether after they have the simulation lab, whether they will increase their self-confidence. So this is for example, this is, we call it satisfaction with current learning. And then for the second part of this questionnaire actually is talking about the self-confidence in learning. So what is the objective of, you can see, is the program, is to develop an intervention with focus on scenario from real life, yet under safe settings, where the students had the opportunity to exchange and apply knowledge and participate in subsequent theoretical reflection. And then the second one is to evaluate the effectiveness of clinical simulation on self-confidence and satisfaction among nursing students. So this is the video you can see from the students' performance.
6歲嘅 Debriefing driver， 咁咧佢咧就 contain 咧left side 嘅有 free refresher 嘅，咁RR 就94% 咁 air 啦，咁 SpO2 94嘅，咁跟住BP 170/93， 咁跟住咧heart rate 180嘅。
1、2、3。
好，先生，嗱，而家咧我會摸你背脊啲骨啊。如果你痛嘅話，你出聲喎嚇。有冇痛啊？嗯。OK 啊嘛，係嘛？好，俾啲 KYJ 喎，唔該晒。OK， 得啊嘛，係咪啊？冇痛係咪？冇。OK， 好。姑娘們同我唔該，可以翻佢轉頭。
1、2、3。
好，同我除埋個 leg collar 佢。
咁麻煩可唔可以幫我準備一個14 bench 嘅 Foley 啦，18 gauge 嘅豆，然之後 NS 要 Q/H 嘅，仲有最後 Paddy 幫我綁咗佢啊。
阿隊長，我想問下點解要插 Foley 嘅？
因為我哋要 mon 住佢嘅 urine output 同埋睇下佢嘅 urine status。
嗯。Well， 打豆要啲咩 equipment 啊
？18 gauge 嘅 anchor cat 啦 ，calendar 同埋箍手嘅橡筋。
點解要18 gauge 嘅？
咁可以令到啲藥陣間打落去會快啲去到血管。
嗯。係咪貼咗 cardiac on 啊 ，Carmen？
係知啦。
好，話俾我聽，而家係咩 rhythm？
normal sinus rhythm。
嗯 ，good。Annabelle， IV fluid 幾多 ？Q 幾
？NS 嚟嘅 Q/H。
哦 ，OK。 條水落唔落啊？
條水落嘅 pattern 嘅。
嗯。
Ella 上咗啦。
姑娘，你做乜嘢啊？
係我而家準備幫你插尿喉啊，過程可能會有少少唔舒服啊，忍耐一下。好，而家幫你清一清潔先，有少少涼涼地啊。好，咁我開始幫你插啦，可能有少少唔舒服啊，咁你忍耐一下。
哇，好痛啊！要做咩啊？
忍一忍啊！
啊！
係，好，有你出嚟，等一陣啊，未得，等多一陣，未。
姑娘好痛啊！
係，忍一陣啊，就嚟完㗎啦。
咁咧 patient 咧就插低入嚟嘅，咁我哋咧就啱啱幫佢插咗 Foley 啦，然之後又幫佢戴咗粒豆嘅，然之後 NS 咧係要 Q/H， 但我哋未教，所以麻煩一陣可以幫手教翻。而 Foley 嗰邊咧我哋就插咗啦，但係我哋未睇 output 嘅，咁所以就想你哋幫手 follow up 翻呢啲嘢，想問下有冇問題？
冇問題，唔該晒。
好。
咁咧，你哋幫我咧量翻個 I/O 啦，咁你就去教翻個 drip 啦。好。
教咗 drip rate Q/H 嘅。
哦。
Fluid output 100 ml straw fluid。
咦 ？Kitty， 1,001，1,002，1,403，1,404，1,405，1,406，1,407，1,408。Patient arrest 咗啊！咁你咧幫我做幫佢做 CPR，然後你拎 ambulance back 啊。
我係醫生啊，可唔可以幫我打大 A 啊？1 mg 3分鐘1支。
好，咁你幫我咧抽大 A 啦，咁就1 mg 嘅3分鐘打一支。好。
18、19、20、22、23、24、25、26、27、28、29、30。
你 CPR 停一停先，想睇下係咪仲有 systole？係，繼續。咁而家2:45咧就打第一支，2:48打第二支。咁 patient 叫 Kitty 啦，38歲嘅，車禍入嚟嘅，左邊斷咗3條肋骨啦。咁而家吊緊咧就係 Q/H 嘅 NS 啦。咁啱啱量 I/O 嘅時候咧，就發現 patient 咧 cardiac arrest 咗嘅。咁而家做咗5個 cycle 嘅 CPR 啦。 咁醫生 order 咗大 A 嘅就係1 mg 啦，3分鐘打1次，咁就已經打咗2支㗎啦。最後一次打咧就係2.48分嗰陣時，咁醫生講緊過嚟㗎啦，有冇問題？好，唔該。
cardiac arrest 同 cardiac interruption 唔可以多過10秒啦。咁唔該你幫我 back，你幫我做 CPR。好，咁你陣間準備抽大 A。
1日、2日、3日、4日、5日、6日、7日、8日、9日、11、12、13、14、15、16、17、18、19、20、21、22、23、24、25、26、27、28、29、30。
Recycle 球之後。
1日、2日、3日、4日、5日、6日、7日、8日、9日、10日。
好，醫生嚟到啦。
13、14。
而家個病人咩情形啊？
病人 cardiac arrest 咗10分鐘嘅，咁你啱啱就 order 咗啦，打2支大 A，陣間就再打。
係，即係未夠鐘係咪啊？OK，如果係咁嘅話咧，停一停先，我想望一望。好，繼續猜。可唔可以幫我準備定 ETT 嗰啲 equipment 啊？不如你幫我去準備塞斯20 mg propofol 200 mg 好冇？咁你幫我攞 ETT equipment，OK？
23、24、25、26、27、28、29、30。
好，第一個 cycle 完結。
1日、2日、3日、4日、5日、6日、7日、8日、9日、10日、11、12、13、14、15。
係咪打大 A 啊？你而家
18、19、20、21、22、23、24、25、26、27、28、29、30。
第二個 cycle 完。
1日、2日、3日、4日、5日、6日、7日、8日、9日、10日、11、12、13、14、15、16、17、18、19、20。21、22、23、24、25、26、27、28、29、30。
第三個 cycle 完。
1日、2日、3日、4日、5日、6日、7日、8日、9日、10日、11、12、13、14、15、16、17、18、19、20、21、22、23、24、25、26、27、28、29、30。
第四個 cycle 完。
1日、2日、3日、4日、5日、6日、7日、9日、10日、11、12、13、14、15、16、17、18、19、20、21、22、23、24、25、26。
好，間膝球唔該。好，唔該。ET tip，茶水 KY 係咪？
係，茶水 KY。
好，兩條數。好，同我駁翻，唔該晒。OK，幫我 hold 住，hold 住。唔該你。好，幫我 back bend，嚟多次。OK， 姑娘同我secure佢啊，唔該晒。大 A 打咗啦，係咪啊？
打咗啦。啱啱醫生嚟過嘅，咁就差咗5個 cycle 啦，打咗 propofol 同測試就插咗 ETT 嘅。咁而家大 A 就total 打咗4支，咁最後一支就係2.54分。咁 patient 繼續 assist 有冇問題？
冇問題。好，唔該。Annabelle 去 back 住 patient 先 ，Kelly 去做 CPR，Jason 同我過嚟搞大 A。
好，同學唔好猜住，望一望而家係咩 rhythm？
VF
係，咁應該點做？
應該要電佢嘅。
好，而家係擺飛行機，咁應該用幾多 energy level？
200做。
好。
I'm clear, you are clear, everybody clear.
而家係乜嘢 rhythm？
VT，
VT， 所以要做嘅係
冇 pulse。 1001、1002、1003、1004、1005、1006、1007、1008、1009、1010。冇 pulse 咁，所以要繼續練。
好，記得 energy level。
都係200鐘。
好。
I'm clear. You are clear. Everybody clear.
而家係兩生一書。Kitty， 嘿，聽唔聽到咧？係啊，幫你插咗條 YouTube 啊，所以你而家唔係好講到嘢。但係你聽到我哋講嘢嘅話，你不如眨眨眼啦。OK 喎。
哎呀 ，Hello Kitty， 點啊？
請問你係佢嘅邊位啊？
哎呀，你好啊，我叫 Daniel 佢老公啊。
哦，原來我哋叫你 Daniel OK 嘛？
得，係啊，點啊，姑娘？
我哋啱啱幫佢做完個急救㗎啦，佢而家個情況都穩定嘅。咁但係咧，你見到佢而家都插住咗條口啦，去幫佢維持翻個呼吸。咁佢而家個人都清醒嘅，咁但係你都可以繼續陪住佢啦。咁佢應該都聽到你講嘢，咁你都可以同佢講多兩句嘅。係。
好，即係而家穩定㗎係咪啊？冇生命危險㗎係咪啊？
係啦，咁之後我哋咧就會送佢上心理治療部嗰邊啦。咁其實都係再密切咁跟進翻佢個情況。咁因為佢喺個交通意外度咧就左邊斷咗3條肋骨嘅。咁但係而家咧經過急救之後咧都已經好穩定㗎啦，咁就唔使太擔心嘅。咁你都可以去陪下佢啦，係啦。
好啊，多謝你啊，姑娘。
唔使。
係啦，咁我陪住佢啦，好冇？
好啊。
係啦，好。
I think this is a very remarkable experience, and with the sim lab, the sim method, and we can try to communicate with the patients, and even we can do a role play with the patients. The teachers or our classmate can control, like he can voice out or he can have some reactions like the pulse, or blinking his eyes. So I think it is very important to communicate with the patients.
I think using SimLab is stimulator that is a good learning experience because it can stimulate the situation just like in real world. So, for example, in our simulation lab, the cardiac monitor changes from normal sinus rhythm to asystole to VF and VT. And it can demonstrate the emergency situation in A&E department. So this can train our problem-solving skills, which is essential for our nursing care.
By using SimMan, I have the opportunity to develop nursing skills through hands-on interaction with the mannequin as well as other student learners. And we can learn from the errors and further discuss it during the debriefing section. As we help to complete the task by ourselves within a short period of time, and the patient's condition may vary during the period. It helps us to culture teamwork, expand critical thinking when making decisions about interventions in critical but not threatening settings.
After watching the video, what have you seen from the video? First of all, you can see the stages, right? We have divided into 5 stages. The first one is patient arrival. The second one is handle emergency situation. The third one is assist the endotracheal intubation. And the fourth one is management of different cardiac rhythm. And the fifth one is communicating with patient's relative. And this is the SimMan you can see from the video. The SimMan, we can also, first of all, inside the setting, we have the SimMan. Also, we have vital signs and displayed it on the bedside monitor. And also, the vital signs include heart rate, BP, SpO2, and also cardiac rhythm. And also, the simulation facilitator controls the clinical progression. And also, you can see from the video that the students are using team-based working. What does it mean? That means they are working as a team, and the team is formulated by from a lot of different characters like nurses, APN, and doctor. Who is the doctor? That means me. And they work together, and then of course they also have a team leader. The team leader directing the team by giving direct orders, verbalizing plans, and also assigning specific tasks to the team. And during simulation, I can also facilitate the discussion, and I will ask a lot of questions during their working on the sim. From the video, I also debrief the students following the trainings. From a lot of literature review, I can see that debriefing should contain 3 different parts. The first one is students reflected on individual and team performance, and the second one is I should prompt the discussion about the gaps identified in leader and also in the team performance. And the third one is I should focus on issues of medical management and also scenario-specific knowledge and skills. And then after obtaining the pre and post questionnaire, you can see from the result here, the result is this, the sample. That means the students consist of 58% female and 42% male. And they are year 3 with the mean age 20.4. And most of them, or more than half of them, have certified in basic life support course. And you can see from the PowerPoint here, the results, the marks here, they have 32.2 pre-test in terms of the self-confidence. And then post-test is 38.4 out of 50. That means it has increased significantly or statistically significant. You can see from the p-value. And then for the second item, that is the satisfaction, also obtain a satisfactory result. That means the p-value is less than 0.05. That means it's statistically significant difference between the pre-test and post-test. What does it mean? The last line, that means to tell you that manage chronically ill patients during a resuscitation emergency is a challenging task even for the most experienced nurses. And utilizing equipment and practicing the skills required during resuscitation from the simulation lab can increase the self-confidence and satisfaction of nursing students. So this is the end of my presentation. Thank you.